So now we shall discuss my favorite topic, that's for sure. We shall speak about the reproductive problems in couples, and we shall also speak about our ways to overcome them. Just a moment, which one? No? Okay. If we shall speak about the reproductive tract problems, we must understand that this is the core problems of women's health in general. Nowadays, more than 1 million of all women all over the world are suffering from sexually transmitted infections. And these infections are widespread, but of course we must understand that this is only just a small part of reproductive health in general. If we shall speak about the reproductive tract infection, we must keep in mind that there are different clinical presentations and different causative agents of them. Sexually transmitted infections, of course, is a very important part of these problems because many of them are asymptomatic, so they do not have any clinical presentations, and still they could be life-threatening. But there are other infections, infections which we call endogenous, like vaginal dysbiosis, and they are caused by microorganisms which are present all the time in human body, in reproductive tract precisely. Bacterial vaginosis, yeast infections, they are very important. And also, there are a group of iatrogenic infections which could be caused by sexually transmitted pathogens, and also they could be caused by microbiota present in female vagina. And so all these different types of infections with different sources, with different routes of enter, they are very important when we're speaking about them. If we shall speak about microbiota of female vagina, why is it so important? First of all, vaginal microbiota is the first line of defense against invasion of different pathogenic or opportunistic microorganisms. So they prevent fetus and endometrium against those bacteria during the pregnancy. But that's not all, because these bacteria are the first to colonize the newborn baby. And so they will become very important for the development of the child's microbiome. And these bacteria have to prevent, first of all, against those microorganisms which we call sexually transmitted pathogens, and some of them are curable pathogens because we can successfully treat them with antimicrobial drugs. And you know them very well: Chlamydia trachomatis, Neisseria gonorrhea, Mycoplasma genitalium, and Trichomonas vaginalis. And if we shall speak about the diagnostic tools which are necessary to detect these bacteria and protists, we just need qualitative PCR. So PCR is the recommended method, and it's considered a golden standard nowadays for diagnosis of these infections. And of course, we must keep in mind, as soon as we are speaking about the couples, that we have to treat the sexual partners as well. It's absolutely mandatory. But the diagnosis of many infections is very difficult and it's really a challenge. Why? Because there is no single pathogen. You can't find a single pathogen when you are dealing with a group of microorganisms. And that's happening when we are speaking about different dysbiotic conditions. The examples are bacterial vaginosis, vulvovaginal candidiasis, aerobic vaginitis, and other. So what shall we do for the diagnosis of this condition? We shall use quantitative PCR because we have to determine each of the representatives of microbiota to determine it quantitatively. So now, what do we know about vaginal microbiota? Our ideas about vaginal microbiota changed a lot during the last century. Because more than 100 years ago, Professor Doderlein was the first who described gram-positive rods, lactobacilli, in vaginal smears of asymptomatic, clinically healthy women. Then, so it was microscopy, as you understand. Then in the middle of the 20th century, the scientists managed to culture this species, and it was called Lactobacillus acidophilus. And for almost half a century, we were sure that all women harbor this Lactobacillus acidophilus in their vagina. But then molecular-based technique came, and we found out that different species of lactobacilli could be present simultaneously in vagina of women of different ethnic groups, of different age. And this is absolutely new knowledge for us. But besides lactobacilli, a wide variety of opportunistic bacteria are present there in vagina also. Despite the fact that diversity for microbiome in vagina is very low, still there are obligate anaerobes, and you know Gardnerella vaginalis, the very recognizable agent associated with bacterial vaginosis, but also many others like Phaenichensia vagina, it former Atopobium vagina, it changed the taxonomic name, but still some new groups, I marked them with red, BVAB, bacterial vaginosis associated bacteria, a huge group of bacteria. And these obligate anaerobe groups constitutes up to 90% of all opportunistic microorganisms. Then less presented are facultative anaerobes, with very important for us Streptococcus B, bacteria Streptococcus agalactia. Also, we can find opportunistic genital mycoplasmas, Uroplasma orealiticum, Uroplasma parvum, and Metamycoplasma hominis, its former mycoplasma, and of course, yeast fungi. They're also present there. And now, what about the diagnostics? The diagnostics approaches to reproductive tract infections changed a lot also in the past century, but we still use microscopy, cultures, and of course molecular-based techniques. Of course, microscopy is very fast and it's relatively cheap, but still the diagnostic errors occur in more than 50% of all cases when we use this technique. And I really love this article. You can find it, and the name of the article is very nice, Throwing a Dice for the Diagnosis of Vaginal Complaints. It means it's better to throw a dice than to use microscopy because it will be less mistakes made. Cultures allow us to isolate viable pathogens, viable bacteria, to perform antibiotic-resistant tests, of course, but still, the majority of reproductive tract infections are caused by unculturable microorganisms like obligate anaerobes or fastidious bacteria, for example, like mycoplasmas. So, and we can't cultivate practically chlamydia. Also, this test is time and labor consuming. So this brings us to molecular-based methods, and of course PCR. And quantitative PCR allow us to identify all the representatives in vaginal community, to calculate their numbers, and we can also calculate the proportion of each group of bacteria comparing to total bacterial load to the total number of microorganisms. And Sergey was absolutely right. It was 2008 when the human microbiome project started in USA. They just started exploring this huge microbial community. And we in Russia had the first variant of FEMOFLOR test. And now we speak about the FEMOFLOR panel, which was developed through the years, and it including FEMOFLOR screen test, which is designed for screening for sexually transmitted infection and for screening for some vaginal dysbiosis. Then, more than 15 years, we loved to work with FEMOFLOR 16, which allowed us to assess 16 groups of bacteria, and today is 2025, and we have FEMOFLOR the second. It's a new generation test which performs the complete vaginal microbiome analysis, because it allows us to detect not only some groups of aerobic and anaerobic bacteria, but also we can perform lactobacilli genotyping. We detect sexually transmitted infection pathogens, herpes virida, and human papillomaviruses. But, well, I shall show you the examples. First of all, just have a look how many bacteria are detected by this test. Total bacterial load in general, as I told you, lactobacillus species, facultative aerobes, obligate anaerobes, genital mycoplasmas, yeast-like fungi, sexually transmitted infections, herpes virida, and human papilloma viruses. And all of them are important. I would like to share with you the algorithm for the analysis of this very complex microbial community. This analysis is performed automatically with the special software after the PCR run is over. But still, I think it's interesting just to understand how it happened. So, first of all, we calculate the proportion of lactobacilli in vaginal microbial community. And when this proportion is more than 80%, then we speak about normal cyanosis or eubiosis, it's more correct nowadays. And also there is a condition when, besides the predominance of lactobacilli, we can detect genital mycoplasmas or candida species in quantities more than 4 to 10 power. And then we speak about conditional normal cyanosis, and you will just consider maybe the treatment of the patient. But when the proportion of lactobacilli is less than 80%, then we speak about dysbiosis. And there are two types of dysbiosis depending on the percentage of lactobacilli. Severe dysbiosis when the proportion is less than 20%, and it means that just 20% maybe, or even less, maybe 1% of all bacteria are presented by lactobacilli. And moderate dysbiosis when the proportion of lactobacilli is between 20 and 80% of all bacteria presented. So here you can see again the criteria for vaginal normal cyanosis and dysbiosis when we assess it by FEMOFLOR test. And in normal cyanosis, the proportion must be above 80%, and in dysbiosis, especially in severe dysbiosis, we shall speak about the proportion lower than 20%. Now, About the lactobacilli composition, which is also very important for predicting of vaginal state microbiota. The newest FEMOFLOR II test allows us also to perform genotyping of lactobacilli. And I would like to remind you, I think many of you know about it, that some species are extremely important, like Lactobacillus crispatus. This bacteria produces highly effective lactic acid. That is why it provides strong adhesion and biofilm formation in vagina. And this bacteria is considered the best friend of girls, frankly speaking, not diamonds, but Lactobacillus crispatus. On the contrary, Lactobacillus iners produces less stable D-lactic acid, and it harbors potential pathogenicity. And we consider this bacteria, when it's predominant in vaginal microbiota, as the marker of future instability. And other two bacteria which are also considered to be very important for vaginal health are Lactobacillus jensenii and Lactobacillus gasseri. Lactobacillus jensenii, I call it the colonizer. And Lactobacillus gasseri, I call the defender, because both of them synergetic to Lactobacillus crispatus, and when we detect Lactobacillus crispatus together with two other species, this is a good, really, type of vaginal microbiota. And you know, I think maybe you know this, you know this publication, this article. It was published in, firstly in 2011 and then modified in 2020. The group of American scientists performed research when they analyzed vaginal microbiota of asymptomatic women of different ethnic groups. And they have created this classification. And as you can see, this classification takes into account not only the predominance of lactobacilli, but also the type, the exact species predominant among lactobacilli. And so there are 4 types with predominance of lactobacilli. The first one with crispatus, the second one with Lactobacillus gasseri, the third one with Lactobacillus ciceri, the fifth with Lactobacillus jensenii vaginalis, and also they detected the 5th type of vaginal community state, which was dysbiotic, according to our ideas. And different types of dysbiosis they also developed. And before the FEMOFLOR II was launched this year, we could not attribute our conclusions to these classifications, but now we can. And by the way, here is the results of Revel's research. He has shown that different ethnic groups really harbor different species of lactobacilli as predominant in their vaginal community. And if we shall speak about Asian group, and it's, by the way, it's true for our city, for Yekaterinburg, we got the same results. 42% of all asymptomatic women harbored Lactobacillus iners in their vagina. And prognostically, it's not the best variant, as I told you. So now it's time to introduce you the new FEMOFLOR test, FEMOFLOR II, and we shall see how different this test from the previous variant. First of all, normal microbiota, which is presented not only by Lactobacillus, by Bifidobacterium species as well, and genotyping of Lactobacilli is performed. Then, facultative anaerobes. What we got here? We got Streptococcus agalactiae here, Enterococcus species, and Haemophilus species, which is also very essential. And as for obligate anaerobes, other important groups were included into the test. Mobiluncus species, Anaerococcus species, bacterial vaginosis associated bacteria, BVAB 1, 2, 3, those groups, they're also included into the test. Other bacteria which are detected by the test, mycoplasmas. Now we can determine uroplasmas differentially, Uroplasma parvum and Uroplasma urolithicum. Fungi. We can also differentiate now Candida albicans candidosis from non-albicans vaginitis, which is also very important. Now we can detect all sexually transmitted infection pathogens. And of course, viruses. As I promised, herpes virida, HPV, and we can determine HPV 16 type, 18 type, so the most dangerous types of HPV. Now let me show you the example of lab report for FEMOFLOR, the second test. This is the example of normal state microbiota, and let me show you that Lactobacillus presented here constitutes for more than 99% of all vaginal bacteria. No sexually transmitted pathogens. Lactobacillus are presented by Lactobacillus crispatus, and so this is the conclusion which is again automatically generated by special software. Now this is the other example. This is the example of eubiosis, normocinosis with presence of Lactobacilli, and again Lactobacilli are present here. Just a moment. So this is the other variant when we also have the eubiosis, because Lactobacilli are predominant, but the predominant species of Lactobacilli is Lactobacillus iners. And this is the second variant of according to Ravel's classification. Again, no obligate pathogens, no herpes viruses, no HPV. So practically everything is good, despite the fact that Lactobacillus iners is predominant. Now let's move the next example, and this is not a normocinosis, because together with Lactobacilli, you can see them here, Streptococcus species are present, and their quantity is rather high, and they constitute to 53% of all bacteria presented here. So besides this bacteria, HPV, the group of HPV is detected, so of course it's not normal. And we must speak about moderate dysbiosis in this case. So you can see. Next example when there is practically no Lactobacilli and practically all microbiota is presented with obligate anaerobes, and I would like to pay your attention that not Gardnerella vaginalis is predominant here, but the group of Bacteroides, Privotella, Parphyromonas is the most presented group. So we could not detect this type of dysbiosis before time. And again, HPV is present, and what else? Chlamydia trachomatis. Chlamydia trachomatis. So this patient has a type of mixed infection, and we detected all the participants of this mixture. So again, Lactobacilli, obligate anaerobes, and our pathogens. Another example, again, dysbiotic condition, when Lactobacilli are decreased, their quantity is decreased, the percentage, and again anaerobic dysbiosis. This is also moderate anaerobic dysbiosis, And look, Neisseria gonorrhoeae is detected together with these anaerobes. And if we have used just FEMOFLOR 16 test, we would not find this Neisseria gonorrhoeae. And you see that, of course, the clinical presentation may be typical for bacterial vaginosis in this patient, and that was a must. And also, HPV was not detected here. This is the only good news. One more example of mixed dysbiosis, because here again the lactobacilli proportion is decreased, but streptococcus is present here, and obligate anaerobes also present here. So this is mixed severe dysbiosis, and without new test, because some new groups were detected here, we could not determine the state of vaginal microbiota. Next, I would like to speak about the comparison of different laboratory tests with each other, because you know, many clinical doctors prefer microscopy, considering this method very fast, rather cheap, and really it gives us a lot of information, but we have to look for something else besides this information. And of course, different variants could be absolutely comparable. They could give us similar information, but sometimes it's not like this. Now, have a look at this example. This is asymptomatic patient, and she has normal vaginal microbiota according to microscopy, and she has normal state of microbiota according to FEMOFLOR, the second test. So it's eubiosis or normal cyanosis. So the results almost similar. And the patient is asymptomatic, so nothing difficult. Now have a look at this example, because this lady has the signs of non-specific vaginitis according to microscopy, a lot of leukocytes, polymorphic microflora, and you just can't understand what's the matter with her. But this patient, you can see, 29-year-old, she has complaints for vaginal discharge, so we have to decide how we shall treat her. And according to FEMOFLOR test, we have the conditional eubiosis associated with ureaplasma parvum. So most probably this vaginitis is associated with ureaplasma parvum, and we have to treat this patient for sure. And of course, when we have this information, we have the clear opportunities for treatment. So let's go in. Okay, so we have the diagnosis, and we have the example of treatment which we can use for this patient. Another lady, look, female patient, 34-year-old, no symptoms of vaginitis, but the diagnosis, primary infertility. And so she was diagnosed before the natural cycle, frozen embryo transfer. And now, if we shall have a look at her microscopy, well, it's quite normal, because no leukocytes, well, some gram-positive rods we can see there, so most probably they are lactobacilli. But now, have a look at her FEMOFLOR test. Anaerobic dysbiosis. What we have determined here, anaerobic dysbiosis, moreover, is a kind of mixed dysbiosis, when half of all bacteria are obligate anaerobes and another half ureaplasma parvum. Do you think her embryo transfer will be successful in case we would not treat her before the transfer? Of course, she was treated and everything was fine. And if we shall have a look for the treatment, again, with this information, we have clear information for her treatment. So it's rather easy. And another example, which I would like to share with you. This is a patient who was treated firstly so first of all, her results before the treatment. You can see that it is anaerobic dysbiosis. Then she was treated with clindamycin, and look what we have seen after the antimicrobial treatment. Her microscopy almost perfect. It's absolutely normal. Again, no clue cells, no cocci practically, no leukocytes. But if we shall have a look at her FEMOFLOR, unfortunately this black bar prevent us from this. But still, everything almost fine, but there is practically no microbiota. Even the quantity of lactobacilli is only 2.4 to 10. So it's very low quantity. So next step was to prescribe her oral probiotic, and then we looked at her after the probiotic treatment. So we can use this test also for the moderating not only for screen, but only for the moderating of females' condition. Also, there are two types of second panel of FEMOFLOR, which are presented with shorter variants of FEMOFLOR, the second screen. The first one is FEMOFLOR Delta screen. It was designed just for screening because it allows us to detect sexually transmitted disease, herpes viridis, without HPV, without lactobacilli genotyping, and only 3 groups of obligate anaerobes are detected by this test. And the other test is FEMOFLOR Alpha screen. FEMOFLOR Alpha screen is designed for the diagnosis of bacterial vaginosis or maybe for treatment monitoring. When we have diagnosed at the first step bacterial vaginosis and anaerobic vaginitis in our patient, then we can check after the treatment if the condition of vaginal microbiota changed. But of course, it was all about women, but about the second part of our couple, about men, because we can't live without men, of course. And there are also the huge necessity to perform successful diagnostic for male patients and for partners of our patients. What is the main cause of seeking medical help in men? Of course, it's non-gonococcal urethritis. It's really the most common reason to seek medical help. Oops. So you can see that still the role of opportunistic bacteria is not quite proved in developing of this condition. Because when sexually transmitted pathogens are absent, of course we speak about some opportunistic bacteria. And before the era of molecular-based methods, usually we thought about some facultative anaerobes like Enterobacterialis, gram-positive bacteria, Streptococcus, Staphylococcus, Mycoplasma sometimes, but what about obligate anaerobes? Well, their role in pathology was not established at all. And so we have the second test, which was designed in combination to accompany FEMOFLOR test, the ANDROFLOR real-time PCR kit. This test allows us to determine quantitatively, again, 24 groups of microorganisms, and they include sexually transmitted pathogens. They include gram-positive facultative anaerobes, gram-negative facultative anaerobes, obligate anaerobes, genital mycoplasmas, yeast-like fungi, of course, sample intake control is present in this test. So practically all male microbiota could be detected by this test. Only we can't detect herpes virida and HPV by this test. We have to use some other test. Here you can see what a group of bacteria are included into the test. You can see that gram-positive facultative bacteria are presented in both variants of this test because they have ANDROFLOR screen and ANDROFLOR, well, the full test. Then gram-negative anaerobes are presented in ANDROFLOR test. Enterobacteriaceae and Enterococcus are detected by both variants of the test. Obligate anaerobes, of course, more groups are detected by ANDROFLOR. Genital mycoplasmas are present in both variants. Candida species and sexually transmitted infections also are presented in both variants of the test. So, how can we interpret this test? Because we know less about male microbiota comparing to female microbiota. First of all, total bacterial load, you can see the value which are considered significant. Then human genetic DNA, this is a control intake, sample intake control, and it also will be valid when the quantities is more than 3 to 10th power. Then we detect transient microbiota. Look, lactobacilli in male patients are considered as transient microbiota, but not always they are just transient microbiota, and we have proved that sometimes they are really important for the urethritis and some other conditions. The normal microbiota is presented by Staphylococcus, Streptococcus, Carinobacterium, in case they are predominant in this microbial community. Opportunistic microbiota in healthy women is not detected, and when we detect them, we compare their quantity with the quantity of normal microbiota. And of course, the DNA of obligate pathogens must be absent. And for yeast fungi, you can see also there is the threshold values. Now about the biomaterials which could be used for this test. The optimal specimen type is determined by a specific clinical presentation. And you can see that in case of urethritis, balanoposthitis, or therapy monitoring, better to use epithelial scrapes or maybe first avoid urine. If we shall speak about the infections, the diseases of the upper male genital tract like prostatitis, orchitis, and other, then it's better to use prostatic fluid, and also we can use residual urine after prostate massage. Even semen samples we can analyze, and even biopsy samples from prostatic tissues. So many variants really. Now I would like to show you the example of ANDROFLOR test result. Here, the bacterial microbiome composition is normal. We detected only gram-positive bacteria. You can see it over here, and practically no other bacteria are detected here, but we detected Candida species here. And it means that in this case, we are dealing with some fungal infection. So you can see it over here. The other example is also the example of normal lab report. Here we can see that sample intake control is normal. The total bacterial load is above the threshold level, but it's still lower than clinically significant values. And microbiota is presented by Corynebacterium, which is absolutely normal, and Candida species is below the threshold level, and no DNA of sexually transmitted infections. So you can have a look. So this is the most important parts of this test for this patient. Now the other example. Here you can see that again sample intake control is good. but the total bacterial load is higher than we would like to see. So this microbiota is presented mostly by Haemophilus species, and that is not normal for male urethra. You can see here Haemophilus, no DNA of sexually transmitted infections again. So this is the most important, the predominant group of bacteria in the test. And another example, also where microbiota is presented by Enterobacteriaceae enterococcus group, which is also not normal for the male person, and most probably this patient will need some antimicrobial treatment because Haemophilus is rather pathogenic. And another one example, the example where we have detected Neisseria gonorrhea. Of course, in case we have found this bacteria, we have to treat both partners and the female partner as well. And at the end of my speech, I would like to share with you the results of our research. We have conducted it a few years ago when we analyzed semen microbiota using ANDROFLOR kit, and we analyzed the outcomes of embryo transfer, of the step of embryo transfer and embryo development during the IVF, and compared the results of embryo development with microbiota of the semen samples used for this IVF procedure. And you can see two examples. The first one, the semen sample from a male patient where the blastocyst development rate, it means how many blastocysts developed in good and excellent quality of blastocysts on the 5th day of cultivating. It was 50%. We obtained 2 good blastocysts out of 4 embryos, and then the pregnancy occurred. And you can see that there was absolutely normal microbiota according to ANDROFLOR. And the other example, where I have detected many different bacteria in the semen sample. This is a kind of mixture of them. You can see that gram-positive bacteria, obligate anaerobe, and lactobacillus were presented there. And there were 8 blastocysts, only 2 of them were good, and unfortunately we did not obtain pregnancy in this case. So we can use this test not only for the analyzing of urethral microbiota, but also preventing our couples for the procedure of IVF, for example. And this is also very interesting research conducted by our colleagues, which have shown that cervical microbiota and semen microbiota are not absolutely comparable. Only in half of all couples, the microorganisms determined in cervical samples were almost the same as determined in semen samples. But in half of all group, they were different. It means that we have to diagnose both partners in the couple. And now, at the end of my speech, I would like to show the main differences between male and female microbiota, which we have to keep in mind when we are treating our patients. Because while lactobacillus are the preferable species for women, for male patients they are not that preferable. Obligate anaerobes are considered as a marker of anaerobic dysbiosis or bacterial vaginosis in female partners, while in male patients, obligate anaerobes could be a marker for prostate congestion. Only Candida species are bad for both partners for sure, yeah? And mixed microbiota usually not good for women of reproductive age, while mixed microbiota could be a variant of normal state of microbiota for male patients. But anyway, now we have 2 tests. We have 2 tests, and the health, the happiness of our couples, of our people is in our hands. Thank you.